Hey, hi, Prof. Good afternoon. How was your day?
Yes, very good.
I think you've been in the practice in this field of oncology for like how many years?
50 years.
Oh, that's very, very long. What are you most proud of in your very long medical career?
The building of the Children Cancer Center. The department actually started as a consultation service for children with blood and cancer, but has grown over the year to be a referral center for children with cancer for local and regional. Over the years, we are very proud to have achieved very high cure rate for the most common cancer in children acute lymphoblastic leukemia, from 50% in the early 80s to today more than 90%.
If you can go back to the past, and what advice would you give your younger self?
I would say that working in a big institution has a lot of advantage. We learn fast, we get a lot of exposure, but it's a lot of hard work. Now, hard work when you're young, you are able to reap the benefit when you're old. Working in a big institution, you also have a lot of colleagues which have different strengths. They may help you with work or outside work, make life easier and more interesting. And working in an institution also build our character to be a team player, at the same time, patient and tolerance.
One of the most important things really in healthcare and like in many other fields of endeavor is to be able to overcome constant change. I had a quote in one of our educational booklet that we do annually for the Singapore National Eye Centre is where it describes the coming years' educational programs. The illiterate of the 21st century is not that people can't read or write, but people are unable to learn, unlearn, and then relearn. So I think that has been my guiding principle to stay relevant because there's so much change over the last 50 years of my time in this campus. Quite key in how we train our junior doctors is how to communicate, how to feel in patients and the family shoes as they look after patients. But one of the things that need to be practiced is how to interact, how to approach patients and the family, and then conduct yourself. If that patient is my mother, how would I make the decision for the family? Doctoring or medical profession is a calling. I think if you follow your passion, purposefully train yourself for that, is mighty useful, you know.
I'm sure you've mentored many junior staff in your years. Would you be able to share with us how that has impacted maybe one of your colleagues whom you've mentored?
Being a role model and a mentor is part and parcel of our life as healthcare professionals. We will still rejoice when we see our juniors exhibit positive attributes and values, remember what compelled them to healthcare in the first place, and putting patients at the heart of all they do. But Daryl, you have been with me for so many years, all right? And we have this mentor-mentee relationship for so long. But maybe you could share, some experiences you have which you attributed to my guidance.
I think you've taught me a lot about negotiation, how to achieve a win-win situation, especially when conditions are very tough, to always go based on principles of patient care, efficiency and productivity so that we gain more as an organization and a department. And in that way, we can benefit more patients in our clinical care. So thank you for teaching me one of many lessons in our relationship.
Well, I'm glad that you found that, win-win situation is the way to go. And I think that is truly how healthcare should function.
So Prof, I've yet to hear about your lifelong journey. Care to share it with us?
Well, my journey with SGH and SingHealth is more than 40 years ago. Started when I was first posted as a house officer to Auto O in September 1980. And since then, all my training has been mostly in SGH and SingHealth. I was involved in the development of hand and reconstructive microsurgery. Not only as a department in SGH, but also as an independent specialty in our country, and training not just of doctors, but also of nurses and our allied health professional colleagues. I think medicine is always changing. I've been very fortunate to be part of this change in the past 40 years, and the aim is always to improve the quality of life for our patients and the public. We must not forget the humanistic part of medicine, the warm touch and the compassionate heart in our interaction with our patients and family, and also with one another.
That was a wonderful and insightful conversation, Prof. Thank you so much.
Cheers.